So you've just heard that you're pregnant. The excitement and the anticipation, as well as the expectations from the outside world, give you a big knock the day you have your baby and you're not feeling connected to him or her. The tearfulness, the sadness, the irritability, and perhaps a little bit of distance from your baby is quite common for many mothers experiencing the baby blues. In fact, 1 in 6 mothers can have full-blown postpartum depression if baby blues are untreated or overlooked. It's very common for many mothers to experience the baby blues. However, when the impact is more intense and it's longer lasting, then you most likely have postpartum depression disorder, which is very serious. It can actually, in fact, impact your as well as your baby's development in future. Often what happens, I like to describe the disorder affecting your mind and your body in 3 particular ways. Often people with postpartum feel excessive overwhelm, excessive guilt and shame, feel that they cannot cope with this little one. The second symptomatic category is the thoughts. So it's the excessive worry, negative thinking, even suicidal thoughts towards yourself and your baby, and having constant, perpetual preoccupations, negative thinking as well, not being able to connect with your little one, and having dark thoughts about wanting to harm yourself or your little one, as well as behavioral outputs, for example, not being able to sleep effectively, not getting enough rest, as well as eating too much or too little, gaining weight or losing a lot of weight are often symptoms that impact you, are the red flags for postpartum depression. I often tell people at the baby clinic here in Johannesburg that I go to, that it's really important not to blame yourself, that having postpartum depression is out of your control. It's not something that you've asked for, and you're not a bad mother. But what is in your control is the choice to seek treatment very quickly. So some of the risk factors to look out for are if you've struggled with clinical depression in your past, or you've got a hereditary predisposition like a parent or a family member that struggled with depression or anxiety, if you've had relationship difficulties and you struggle with support, if you've had a miscarriage or you've experienced death or any types of trauma, or you've had excessive amounts of stress, these could all be precursors to having postpartum depression. In fact, there's also a link where premenstrual syndrome is linked to postpartum depression after having the birth of your baby. So it's really important that you look out for these things and to be mindful and to take care of yourself. If you're struggling or you're worried about your partner struggling, please speak to your baby clinic or your GP for some assistance. You can either seek a psychiatrist or your gynecologist to prescribe medication that can assist in calming down the symptoms and lifting the mood, and assisting you to be able to feel lifted to connect with your little one. And cognitive behavior therapy, which is a very specific type of short-term therapy that can address those negative perpetual thoughts and feelings to help you gain some self-control and to provide you with the right kind of support. The psychologist, as well as yourself, will provide you with some self-help tools as well to help you to feel more empowered in reconnecting with your little one. I often tell the mothers that come and seek some guidance that not getting the right kind of help can impact your baby's future development in the way that learning becomes a lot more delayed. They have cognitive impediments. There's a likelihood to have ADHD, for example, and behavioral difficulties such as acting out types of behaviors and having a lot more of a difficult temperament. There's often a link with children that have had mothers that haven't sought therapy, where the onset of depression and anxiety is a lot sooner in childhood, and children often display clingy and codependent types of behaviors. So it's really important to seek the right kind of help, because most parents want the best for their children and want to see a child thriving rather than regressing. So it's really important to seek the right kind of help. You are not alone.